to health matters now. The Nigerian Association of Resident Doctors has given the federal government a fresh 24-hour ultimatum to meet outstanding demands following the expiration of their earlier 10-day deadline on September 10. This decision came after a 6-hour virtual meeting of the association's National Executive Council. The doctors demand immediate payment of the 2025 Medical Residency Training Fund, settlement of 5 months' salary arrears from the Consolidated Medical Salary Structure Review, and other long-standing backlogs. They also seek payment of 2024 accruitment allowance arrears, specialist allowances, and restoration of the recognition of West African postgraduate membership certificates. The communique was signed by NAD President Dr. Tokpe Oshundara, General Secretary Dr. Oluwashola Odumbaku, and Publicity Secretary Dr. Omoha Amobi. And now the Publicity and Social Secretary, National Association of Resident Doctors, Dr. Amobi Omoha, joins us now to shed more light on this. Dr. Amobi, thank you so much for joining us.
Thank you for having me. It's my pleasure to be here.
So the federal government already promised to address the association's demands. Why the sudden urgency and strike threat now?
I will start by saying there's no threat or urgency. This ultimatum has been there for more than 2 months. When we finish our OGM in Calabar last 2 months, that's July, we issued 21 days ultimatum to the federal government and advocated about it to the different stakeholders. After that, we have several meetings calling the attention of the federal government to do needful. When that 21 ultimatum finished, we give another 10 days ultimatum, and that one finished last few days, that is 10th, before we give this last one. So it's this sincerity and the fair to hit the part of agreement by the federal government. We just want the federal government to be responsible and do the needful and save the nation. Moving forward, we want them to do the needful and be responsible and do what we voted them to do. The stakeholders, that's why we're asking you, the newsmen, the stakeholders, the opinion leaders, to ask the federal government to do the needful and save the crisis that are about to befall the health sector.
All right, talking about doing the needful, you're asking for a training fund, 5 months arrears, salary backlogs, payments, amongst other demands. But do you realize that this administration has been borrowing money to fund its expenditure on other critical projects?
Okay, I will start by saying that I'm not a financial advisor, I'm a medical doctor. And if I'm to advise, I will say that we place our health sector a priority. Because the reason why you're working today is because you're healthy. And the doctors working need all these things, need to be taken care of. Doctors don't go to physician and ask them to give us free of charge. Doctors don't go to a restaurant and get food free of charge. You can't even go to a bank and ask people to give you money. If you're a banker and a doctor meets you, you will ask him to bring collateral. But if you are an agriculturalist, we have Bank of Agriculture, we have Bank of Industry, that people that want to open industry access loan with single digit. But doctors don't have that privilege. So we were asking the federal government to take care of doctors so that we have a state of mind and take care of people that need us. That is why we are begging. We're asking people to come to our aid so that we save the remaining people working. This is the reason why people are leaving the country, because they not prioritize the health. We're talking about Jackpot syndrome, because every day we're talking about capacity building. But now we should be talking about building the capacity that we already built. People are leaving. Now it's no more Jackpot. People are leaving even to other places being paid better because of this pay disparity. People are leaving. So what are we facing in this country? We are begging. Doctors are the most passionate people. We are working. Look at what we are begging for. This is arrears. We're not even asking for new arrears. Exam is coming. for the resident doctors that to make them qualified to be a consultant. Some of them don't even have money to pay. In 3 weeks' time, they'll go for the exam. We are asking for the government to pay this money every year. Instead of fighting every year, we have to go on strike. We have to beg for the federal government to do it. It's high time we hold them accountable in this country so that they will save the remaining people that we help and save the healthcare sector. Thank you.
I understand how sensitive this particular matter is, but then, just as you said, this particular strike, even backed upon, might just cripple Nigeria's healthcare delivery sector. Are there probably other alternatives that you could exhaust, other channels that you could employ to reach out to the government to do the needful rather than embark on an industrial action?
Doctor, apart from the healthcare providers, doctors are great managers and great leaders. I'm telling you that we have explored other ways of conflict resolution. We have been advocating. That's why we're having meetings with the Ministry of Labor, Ministry of Finance, Ministry of Health, which is our parental body. Even the NMA, our parental union body, also advocating for people, advocating for the government to do the needful. When we finish advocating, that is why we're even compromising. It's not easy to work without pay. It's not easy to work in this condition we're facing ourselves. Let me ask you, do you come, if you don't have money, will you come to work today? I know you will not come. I will not even want to try it because you cannot work on free. But doctors are working free of charge. I'm telling you, doctors in this country are poor. We are 1 month away from poverty. It's high time we speak the truth to the federal government. It's high time we speak the truth to the authorities so that they will do the needful, so that our system will work. We want doctors are passionate about their work in this country. We want the system to work. That's why we're working. And they're owing us 1 month, 2 months, 3 months, 4 months, 5 months. This arrears is for 2023, not even last year or this year. What else are we asking for? Specialist allowance. What else are we asking for? This medical residential training fund, that's what we're begging for. It's our chain that we used to go for training, we use for exams. We are asking for it. But up till now, the federal government are yet to do the needful. So what do you want us to do? That is why we are in this mess. So the way forward is the federal government to be responsible, and they do. In fact, there's still window of gap for 24 hours for them to do needful. We are don't like strike. We don't want to go for strike. We want this thing to be resolved because we have parents in this country, we have uncle, we have sisters, even doctors can be sick. No doctors can afford antibiotics in this country. No doctors can afford anti-malaria because of the poor remuneration we have. That is why people are leaving to look for greener pastures. We want them to pay attention to welfare so that we really retain the small capacity we have. Thank you.
Well, thank you very much, Dr. Amobi Moha, for sharing these details with us. We hope that the Nigerian government will be able to do the needful and come to the rescue of course, our doctors, because they are essential workers and we need them to stay functional in this society. Thank you so much for sharing these with us.